Assalamu alaikum. I'm Dr. Farhana Ahmed, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I discuss very important topic, introduction of autonomic in pharmacology. Our nervous system is two types, peripheral nervous system and central nervous system. Central nervous system again two types, brain and spinal cord. And peripheral nervous system two portion, somatic and autonomic. Autonomic portion again two portion, parasympathetic and sympathetic. What is autonomic nervous system? The word autonomous means self and nous means governing. The autonomic nervous system is one when it is not under voluntary control. Autonomic nervous system is the major involuntary, unconscious, autonomic portion of the nervous system. Unconscious body function such as all exocrine and endocrine function, heart rate, blood pressure and some metabolic function. And functional division of autonomic nervous systems. Number 1, sympathetic or adrenergic. Number 2, parasympathetic or cholinergic. Number 3, enteric nervous systems control the gastrointestinal function. And sympathetic or adrenergic nervous system include thoracolumbar origin, response to stress, fight or flight, main neurotransmitter, noradrenaline, adrenaline. Parasympathetic or adrenergic nervous system, craniosacral origin, homeostatic function, rest and digest, main neurotransmitter, acetylcholine. And enteric nervous system control gastrointestinal function. This diagram shows the sympathetic versus parasympathetic sympathetic. Sympathetic include increased blood pressure, heart rate, glucose, perfusion to the skeletal muscle, mydriasis or bronchodilation. In parasympathetic, rest and digest. On eye, meiosis, decreased heart rate, blood pressure, bronchial secretion, insulin release, digestion, excretion. This diagram shows some feature of sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system, summary of response in sympathetic nervous system, fight or flight, in parasympathetic, rest and digest. Spinal cord distribution in sympathetic nervous system, thoracolumbar, in parasympathetic, craniosacral. P-ganglion neuron in sympathetic nervous system, short and parasympathetic, long. P-ganglion neurotransmitter in sympathetic, acetylcholine and parasympathetic, acetylcholine. Postganglion neuron in sympathetic, long and parasympathetic, short. Postganglion neuron transmitter in sympathetic, noradrenaline, mostly, parasympathetic, acetylcholine. This figure shows the function of sympathetic and parasympathetic. Sympathetic function on eye is to constrict the pupil, on salivary gland, stimulate the flow of saliva, on heart, slow the heartbeat, on bronchi, constrict the bronchi, on stomach, stimulate the peristalsis and secretion, on gallbladder, stimulate the release of bile, and bladder, contract the bladder. Sympathetic function on pupil, on eye, dilate the pupil, on saliva, inhibit the flow of saliva, on heart, accelerate the heartbeat, on bronchus, dilate the bronchi, on stomach, inhibit the peristalsis and secretion, on liver, conversion of glycogen to glucose, on solar plexus, secretion of adrenaline and noradrenaline, on bladder, inhibit the bladder contraction. Now I discuss what is autonomic drug. The drug that produce their therapeutic effect by mimicking the function of autonomic nervous system are called autonomic drugs. What is neurotransmitters? The neurotransmitters are the specific chemical signal that release from nerve terminals and responsible for communication between nerve cell and effector organs. This neurotransmitter release is triggered by the arrival of the action potential at the nerve ending. What are the type of neurotransmitter according to their action? Number 1, excitatory. Number 2, inhibitory. Number 3, both excitatory and inhibitory. Excitatory include glutamate, aspartate. Inhibitory include GABA, glycine. Both excitatory and inhibitory, acetylcholine, noradrenaline, histamine, prostaglandin, dopamine. Now I discuss criteria of ideal neurotransmitter. It should be present, number 1, it should be present in presynaptic neuron along with the enzyme synthesize it. Number 2, it should be released in the presynaptic cleft following nerve stimulation. Number 3, its application should produce response identical to the dose produced by the nerve stimulation. Number 4, its effect should be antagonized or potentiated by other substance with similar altered effect of nerve stimulation. This diagram shows the release of neurotransmitter. Action potential arrived at the axon terminal, open the voltage calcium channel open, calcium enter into the cell, calcium single to vesicle, vesicle move to the membrane, dog vesicle release neurotransmitter by exocytosis, neurotransmitter diffuse across the membrane, synaptic cleft and bind to the receptor and produce action. Cholinergic neurotransmitter is acetylcholine. Another diagram shows the release of synthesis of acetylcholine, storage and release of acetylcholine, and their degradation of the acetylcholine. Acetylcholine synthesized by the choline acetyl transferase catalyzes the choline acetyl transferase enzyme. Choline acetyl transferase catalyzes the synthesis of the acetylcholine from the choline and acetyl-CoA. This acetylcholine stored into the vesicle. That acetylcholine released into the synaptic cleft, synaptic and bind to the receptors, and this acetylcholine is degraded by the choline acetyl transferase in synaptic cleft. This acetylcholine divided into the acetate and choline. This choline is taken by the neuron and transport to the neuron and is inhibited by the hemicholineum. This diagram shows the transmission of the cholinergic. Acetylcholine is synthesized by the choline acetyl transferase in acetyl-CoA synthesized in mitochondria and choline transport into the neuron. This transport choline blocked by the hemicholineum. Acetylcholine transport into the seminucleus vesicle. This transport is blocked by the vesicle. This acetylcholine released by action potential calcium dependent triggered by action potential calcium dependent. This acetylcholine release blocked by the botulinum toxin. Acetylcholine bind to the receptors. This acetylcholine is catabolized by the enzyme acetylcholinesterase and break acetylcholine into the choline and acetate. Terminate the action of transmitter. Half-life of acetylcholine is very short. Acetylcholinesterase enzyme goes to the other cell, red blood cell, and it is other enzyme, butyrylcholinesterase enzyme or pseudocholinesterase enzyme. Thank you.